I'm Dr. Piya Gandhi, and welcome to my podcast. Today, I have a good friend and colleague as my guest. I'm really excited to have Dr. Kalli Hale here.
Thank you.
We're here today to talk about not only early signs of pediatric airway disorders, but also how to do all the things as a woman and a mom and a wife and a business owner and a practicing dentist. Share some of the journey that we've been on to make our dreams come true, really. So welcome.
Thank you so much for having me.
Yeah.
And talking about this for so long. We're finally getting together.
I would love to start by just hearing about your journey into the airway space and how it all started for you.
Sure.
We'll just love to
I would love that.
about you.
So I grew up in a family of dentists, somewhere 5 in my new family. My parents met in dental school, and the rest is history. Like, as I like to say, my younger sister's a dentist. I'm married to a dentist. And my older sister is the only one in the immediate family that is not a dentist, but she runs the businesses for us. So she is vital part of all of this. And, I got out of school, as anybody does, and as a general dentist, and you're just practicing dentistry. You're learning, and just enough to not be a danger, And it was such a blessing for me to walk into my dad's practice, to have him behind the wall to save me from anything, anytime I needed, and an established, he'd been there 30-something years by the time I joined him, and learned so much. I did a implant residency. I thought, man, I'm going to do surgery, because that's what he did. He had his own course for many years, and life was just happening. And I started hearing about sleep apnea, but from an adult perspective, nothing with pediatrics. Back then, it just was very, blue ocean, all of this, OSA stuff. And dental school, I was UT, great dental school, but we can talk about this. We can talk about sleep apnea.
Yeah.
And they are more now, I hear, because I've been asking, and that's great, but it just was not a thing.
Yes.
And I started screening before I even had any of my own home sleep test machines. I used a company that, if the patient was serious enough, they'd get in contact with them and then get it tested, bring it back to me. It was the worst flow you could have for your patient. But I certainly didn't know what sleep test machine to buy, and I wasn't going to invest in it at that time, and didn't even know what I didn't know. So I start screening because I see, okay, this patient's bruxing, or their implant button, the screw keeps coming loose. Why is it happening? And of course, all the things in general dentistry you blame yourself for as the clinician. They broke their crown, or their crown keeps popping off, or whatever. And we're just so focused on the tooth and that's it, nothing else. So we're not thinking well, why is the bruxing happening? What else could be going on? I knew little or nothing about snoring. Actually, my dad used to offer this appliance to patients for snoring called an FA. Oh, do you remember this thing? Mm-hmm. You stick your tongue inside of it.
Yes.
And it just holds your tongue out of your mouth. And he just his patients loved it. And so he was treating snoring, probably sleep apnea. He didn't even realize, it just was a great option for airway management at the time. And so I started telling him, I want to start treating patients. And I started catching it left and right. I didn't know what to even do with it. I would get these reports back, and I'm these patients are severe. Yes. They have severe obstructive sleep apnea. And what do we do? Where do we go from here with this? And so I started just hearing about courses and options, and for any dentist listening to this, it is so hard. There are so many.
Yes.
You got to navigate the field to figure out who do you trust? Where do you want to get educated? How do you want to approach it?
There's no streamlined.
Exactly. Yeah. And I think it's because it's all been so new for the last 10, 15 years. And now there's a lot of great evidence supporting certain modalities. I think it's great. But back then I was just swimming in the ocean trying to figure out how to help these people. And so I did a lot of various CE and was learning about it. When I learned about the pediatric side of this, it blew my mind. And I really only intended on ever treating adults. I was the general dentist that was happy to refer to peds for everything. I didn't want to give them a shot. I didn't want to do any even restorative on the kiddos. And now I just I love the kids.
Yeah.
It was so amazing.
Do you currently predominantly treat children or adults, or
so we do both in our practice?
Okay.
Yeah, we do both. But that whole journey was just such a ride of realizing that what we had been taught about pediatric snoring and bruxism in my peds rotations in dental school was completely wrong.
Yes.
I paid a lot of money to go to school there, and we're worried about sealants when we should be screening for sleep disorder breathing in kids, and that should be the focus of their peds program. And so, it was just kind of rewiring.
Well, I went to pediatric residency and still didn't learn.
Yeah, it's true.
2 extra years.
Yeah.
And still didn't learn about those things. So
crazy.
What are some of the early signs that parents should be looking for? And also just our general dentists and our pediatric dentists, what should they be looking for in these kids?
Yeah, I mean, I think mouth breathing is one of the worst things that is the
Number one, if your patient is mouth breathing, we have to fix that. Like, they need to become a nasal breather by the time they're an adult, period. Or they will be an adult with a mouth breathing problem. But in dentistry, I would say from a general dentist perspective, we were seeing bruxism all the time. And we were taught to tell the parents that the grinding was normal and they'd grow out of it. That's literally what my pediatric professor told me at UT. And same with snoring. Oh, it's fine. They'll grow out of it.
Yes.
Where's the evidence for that?
Yes.
Where do they get that? Well, why was that something that was told? So I think those are the two biggest that dentists will see and relate to, because if you are a family practice and the kids are coming in anyway and the parents are saying that, we need to be referring for an airway evaluation immediately with that at the first sign of it.
Yes, I agree. I tell dentists, you don't need to know how to treat the things.
100%.
So don't let that be a barrier to getting into starting the screening.
Right.
Just look for the signs.
Absolutely.
As you said, mouth breathing is a really easy one to pick up on because you can just look at the kid when they're in your chair. And, we traditionally think mouth breathing, the mouth has to be like gaping open. Right. No, it can be just very slightly open. And a very common thing that I hear from parents is they have their mouth open, but they're breathing through their nose. That's not a thing. So if their mouth is open, it's for a reason.
Right.
But I just think we're not educated on these things, even as professionals.
Right.
So as a professional, there are actually 6 things that contribute, the Ferris 6. Yeah. So this is research backed, which I love. Now we have research to show us this. But 6 things in children that will put them at a higher risk for sleep disordered breathing. So mouth breathing, a very obvious one to look at. Dental wear. So I think looking at the eye teeth or the canine teeth are the easiest. Parents can even spot this or hear the grinding.
Yes. Yeah. Oh yeah, they'll say, I hear it from the other side of the room.
Exactly.
Right.
Tonsillar enlargement, which if you're a dentist, you're already looking at tonsils on your regular exam. So 100%. These are things like you're already looking at. Yeah. You're just not putting the pieces together.
Right.
And even as a parent, like if a pediatrician looks at their throat and says, oh, their tonsils are big, that should not just be a passing statement.
Right.
That, okay, why?
Right.
We have to take the next step to the why.
Absolutely.
And then tongue tie, which is a big part of oral function. Yes. Also something that we're not taught about and it's not really talked about with parents.
Totally.
And then I think the hardest one to explain to parents is what a mentalis strain is, which is,
for sure.
Kind of, I call it like the scrunching of the chin. But really it just tells us that our jaw is not in the right spot. Beautiful. So as a dental professional, that is what I teach other dental professionals just to start with.
Yep.
Have this little cheat sheet called the Ferris 6. It's free. You can print it and just start looking at these things. And then once you see them, you'll start seeing them everywhere.
You can't unsee it.
Yes.
It's going to plague you, which just identifies how big of a problem this is globally for our kids. And we're so many generations in at this point, but most of these kids need early treatment.
Yes.
It is just crazy. Yeah, that's a perfect entry level way for these doctors to start looking at it and identifying it. The tongue tying thing is kind of crazy to me. So I had my frenectomy done when I was 37.
Wow.
37, 38. I was so bad. I joke with people that it's amazing I amounted to anything in this life with the kind of tongue tie I had. Okay. Wow. Tip to end, grade 4, couldn't elevate, none of it.
Wow.
And I remember driving, Dr. Rachel Garrett did mine. And a good friend of mine. Yeah. And I remember driving to her office the day I was going to get done. I was so excited. I had done all this myo and all this ortho and all this stuff. Yes. And I called my parents. I'm like, why didn't you fix this for me when I was a baby? Because they're just roasting them a little bit. Yeah. And my dad was like, honey, they taught us not to do anything about those because they told us they would just grow back. And myofunctional therapy was just not understood.
Yes.
And it existed, but it wasn't taught. And he had neither he or my mom had any, education that or anything about myo.
Yes.
So I'm probably kind of glad they didn't, although it was so bad that it would have been great to do. But he said, your pediatrician said you could talk, which I never had issues talking.
Yes.
I fed fine. My mom nursed me. I'm like, how?
Yeah.
How did you do that? And whatever. But it is such great perspective for me now when we're talking to our patients about getting it done, doing the myo, making that investment early so they don't have to have all the issues I had with and growth and development.
You brought an important point up about the myo, but also just the importance of collaborative care in this field in general. Yeah. The airway space, tongue ties specifically also. But in your opinion, when we're talking about collaboration,
who's at the table? Like, who are the must-haves in an ideal world, right?
Yeah.
I don't think we're there yet.
Yeah.
But if you could put together, we're treating a child, who are we talking to?
Who's everybody?
Yeah.
We spend a lot of time right now on this in the airway dentist, as we've got a lot of practices kind of booming and opening.
Yes.
I'm like, we have to have our people.
Congratulations.
And so, well, thank you. Yeah, not trying to just like toot my horn, but it's so important. The collaboration is like, where we go into a new market, we need to find our ENT, we need to find our chiro, we need to find our craniosacral, our lactation consultant, our myo, our SLP.
Yes.
Like for me, it's everybody, because it's not the Kalli show. I see this every day. The doctors I train, the doctors that work for me, it's not the Amanda show. It's not the Kalli show. It is about this child getting individualized treatment for their care. And if they need to see ENT, and I'm also always, what are we treating? Any cases I'm reviewing with them, show me where the dysfunction is so that I know that you know what you're treating these patients, because it's not all the same. It's never cookie cutter. And so it's a really important part of it. So I would say chiro, functional medicine, pediatric dentist, like IBCLCs, SLP, myo, ENT. Yeah.
Where do you
What about
find same?
Okay.
And what I would love to add to that is more of our medical field, sleep medicine.
For sure.
You know, there are ENTs, but some. And we live in the 4th largest city in the world, in the country.
We are very lucky with what we have around us.
Yes. Others,
not.
there's even, it's even more scarce.
Yes.
But, you know, I think this is a problem that practitioners face, but parents face when they're looking into who do I listen to? Like, what do I do next? Because we're all not on the same page yet. I would love for our pediatricians to be on board. I would love for all of our pediatric dentists to be on board. Recently it's tricky because not all of my patients that I'm treating for airway are also our dental patients.
I know.
So they may be seeing another provider for dentistry.
And they may critique what you're doing.
Or they even don't understand it.
Of course they don't.
And I think that's the issue, is that when we don't understand something, the default is critiquing it rather than seeking to understand it. And I'm the type of practitioner that I'm like, I'm happy to hop on a phone call with you and tell you what I'm doing, you know.
Yeah.
But who gets caught in the middle is the patient and the parent.
And very awkward for them.
It's very awkward, and it makes them doubt their decision.
100%.
So, just yesterday I got a call from a parent that said, I went to my dentist for a checkup with my child, and they said he now has enough space and he didn't need the expander to begin with. So I just want you to take it out.
Oh my goodness.
And to me, I understand where this parent is coming from, because I was that parent. And I'm in the dental field, and I was that parent.
Right.
Because as an infant, my daughter had a tongue tie and I didn't know about it, and I got different opinions about what was going on. So I get that.
Yeah.
But what I don't love is the one who's going to suffer is this child.
I know.
And
forever. It is a lifelong decision.
When we talk about people being at the table, I think we need to get our own field all on the table first.
Yeah.
And, that brings in the point of, you're an educator, I'm an educator. When we speak to other dentists that are interested in this, the question is always, well, how do I do all these things?
Yeah.
Especially if you're a female and a mom and a
wife,
and you want to take care of your own health, and have some balance, and be present for your own children. How do you fit all these things in? How have you done it?
Yeah, the burnout risk, I think, especially for female dentists, and when you're a small business owner, is huge. And I lived it. I completely lived it. In the height of my booming airway practice, way before the airway dentist even existed, I really couldn't manage it. And you get to the point where the thing that you love to do the most, that you're really freaking good at, becomes the thing that you want to run away from.
Yeah.
And then you think that dentistry is the problem, and it's not. It's what you've taken on. It's your mindset around it, and then your lack of boundaries. I had a serious lack of boundaries.
Yep.
Patients could get a hold of me anytime they wanted. They'd find me on social media. They're asking me about Zoom whitening at 9:00. I write about that in the book. It's just things where I needed really my own boundaries that I just didn't have.
Was there a moment that made you realize I have let kind of let people into my circle.
Yeah.
And I have let go of these boundaries that made you pause and say,
yes,
something's got to change.
There were two major things that happened. One was an evening that I was on my phone I get a message from a patient and it was a big complaint about something. I have 5 associates. I didn't even want to open it. But at that moment, I didn't have the boundaries of not opening it until Monday. And because this patient could message me and knew that they could bypass whatever my management was saying or whatever to get it to me, it was one of those things where I looked at my phone and I just like, my heart rate increased. I write about like the physiological symptoms that I was ignoring in my body. I had like a crazy high blood pressure moment at work one time. I wasn't even with a patient. I'm just chilling, hanging out with my associate. We're talking about like shopping or something. And everything went tunnel for me. And she was brand new. She had just graduated. And she's talking to me about something. And I was like, Katie, you gotta get blood pressure right now. Because I was gonna pass out. And it was like 180.
So your body was telling you.
There were some things that were happening that I thought my iron was low, which it was. I had babies, my vitamin D was off. Like I just kept like, just go. You fish through, you do what you have to do.
How did that translate into your personal life?
Well, so I was home when I saw this message. And my husband, we were together since high school. And he's just my hero. He's my secret weapon behind the scenes. And I just said, I cannot do this anymore. And I just like dropped my phone. He handled it. He grabbed it. He messaged, and he was like, "This, this is the. I don't even know how. He basically, this isn't Kalli. You're not talking to Kalli.
Yeah.
Any of this kid." And it was like really not a vet. I never read the message, but it just affected me that way because it was already, So the personal one was that we talked about it a little bit on our podcast. What it was like. I had one episode that was completely on burnout before I was ready to move, and he talks about what it was like to live with me during that period of time. Because I was extremely distracted and I was very hard to be around, and everything was a big deal. And at the height of burnout, you'll do what they call catastrophizing. Everything's a catastrophe. Like your assistant forgets one thing and it is the end. Yeah. Yes, it's not. Yes. You've lost your filter because you only have so much you can hold in your cup, at any given time. So that was, the personal journey of that was rough. But the thing that happened at the office that I knew I hit my breaking point. Something hadn't changed. It was I walked in on a Thursday. It was actually a day that my husband was working with me because he used to do a couple days a week clinical. And I have 2 associates and him and me, all 4 of us in this doctor's office. And I walk in, I set my back down, and walk into open top. And my schedule was so horrific that the only way I can explain it is it was abusive. There was no lunch without asking me. I had probably 45 patients booked between 9 and 2. And it was just, I can't be, and then hygiene. We started color coding with the patient had to see Kalli. It was purple. So it was legitimately nobody had taken the
time. And I have a huge treatment coordinating staff. I get it. Everybody's trying to appease everybody. But I walked out the back door.
Wow.
And so Kyle, I didn't even say a word because I had a panic attack. I was literally I'm going to drive away and they can figure this out because that is not okay. Yeah. And I don't look at my schedule the day before anymore. I did as a new dentist, but I don't need to carry it in tomorrow. So I had no idea that was coming, and it just hit me. And I walked out the back door, and I must have taken I didn't even say a word, but Kyle's known me since I was 15.
Of course.
And I must have taken a weird breath or something, and all of a sudden he was outside with me, and I was just and he was so mad. He couldn't believe. You walk in, and you look at your schedule, you're looking at your column.
Yeah.
Well, I had 2, and there was twice as many people on both that should have been there. And so he wasn't necessarily looking at mine, he didn't recognize it, and then just fixed it. I just always tell him, you make my problems go away. He just fixed it. He walked up there and he was like, half of this needs to go. She's taking lunch or she's going to leave. And it was just a big deal. So those are the 2 big things.
And I think to your point, when you're already up here, just every little thing is now just stacking on top of that. Yeah. I can totally relate and understand. And I also think this is more common with women because we want to take on and help. And, especially if you've been through any of this airway journey on your own, how much impact you can have. Right. And we'll do it at the sacrifice of ourselves
100%.
For others.
100%.
And for me, and anyone that has worked in this airway field, once you start, your business is going to take off because so many kids need this, so many adults need this. And so it becomes hard to draw the line and make a limit.
Especially when you're the only one that can do it.
Yes, especially when you're the only one that can do it. And especially even if you train other doctors, they're still looking at you 100%. Constantly. Yes. And for me, it was 2 years that things we were not expecting them to take off.
Right.
And it was just this, before you knew it, life had happened to me.
That's literally the case. Yeah.
And really who suffered was my family.
Yeah.
And me and my health. And, just the other day, my daughter was saying, oh yeah, Mom, I used to remember when you were away almost every weekend lecturing. Oh. And, from a professional standpoint, I was getting so much praise and accolades for teaching, and it was great. Yeah. But it was also at a huge expense. Yeah. Exactly. Yeah. So I don't want to discourage other women
certainly not
going into this field, or any dentist. It takes work, and especially initially when you're educating yourself, when you're building your systems. But I think the thing that I lacked that would have really helped is a vision of what I wanted it to look like.
Absolutely.
Exactly.
A roadmap.
Yes, because I just kind of went along with it, and it became a beast in itself.
And you say yes,
which is not a totally bad thing.
Right.
But I had to look back and then pare it down.
Yes.
Whereas if I had a vision of this is what I want it to look like, and I'm going to build towards that, I think it would have been a lot easier to kind of make those boundaries.
Yeah.
And
even understanding how to make the boundaries.
Yes.
Yeah.
Yes.
So I mean, I could not agree with you more. I had no mental support for what this kind of success was going to look like for me. And on the outside end, people are always going to say like, "Oh my gosh, well, lucky you," and all this stuff. Well,
what a problem to have.
Off to do it, as did you. Yes. But you get to a point where that hotel room is a freaking lonely place to be when your family's at home. It was the same for me. I was doing it every single month, sometimes more than once, not every weekend. That's a ton. I can't even imagine. And my mom finally told me, "Honey, you got to start saying no."
Yeah.
And it was like the money wasn't even worth it at that point.
Yeah.
And that's what people don't understand. Like it just. And I remember thinking like, oh, what a high. You get off stage. All these people are so thankful because they've just never heard this stuff before. And now they see it. They can go help. And our impact is huge because of all the people downline that are going to be helped and all of that from it. And then the high comes down and you're on a flight at 11 o'clock at night trying to come home.
And you're exhausted.
So tired.
Yes.
Yeah.
And so you have written a book.
Yes.
And you talk about a lot of this.
Yeah.
So tell me about your book. Who's the intended audience?
So
when it's coming out.
Pediatric Breathing Project, first to hear.
Yes, we're so excited.
It is the dental burnout solution.
Okay.
And part of my success in getting over the burnout was I read a book by Dr. Sharon Grossman. And this is a really fun story, but I was just, as you guys know already, I was at a peak and I just started Googling burnout books. I didn't even know what burnout was. I was just like, my dad said, you're burnout. And I was like, okay, well, I need to Google that. I don't know what that is. And I just stumbled upon this book on Amazon, total God thing. And I was reading the reviews and I was like, man, she has helped like Fortune 500 CEOs, like pilots, like all these people. And she just has this great like framework. And I can follow the rules. Yes. Like, give me the rules, give me the steps, and I'm going to do it. It took me about a year to read because it was a project book. And one of the first things Kyle and my dad sat down and they were like, we're going to lose Kalli as a practitioner if we do not help her fix this. And I took one day off. I was Monday through Thursday full time, and I took Tuesdays. Tuesdays was my day. The nanny still came. The kids were still distracted.
That's so important.
Yes. Like
it's really your day.
For me.
Yes.
And I would read this book in the mornings with my coffee, and it was like every page was applicable to me. Yeah. It changed my life. And I randomly got an email from her. I'm on her listserv. And I just decided I was going to send her an email and just tell her like how much the book changed my life. And I literally made it one sentence. Okay. Like I was busy. Okay. Mm-hmm. I go, Dr. Grossman, I just want to let you know your book changed my life. I hope I get to tell you the story one day. And I just ended it there. Kid you not. She emails me back at the end of the day and she goes, I'm sorry, what? Like, can we talk? Like,
that's so cool.
Long story short, we wrote the book together. So we're writing one specific for dentists. And it's called The Dental Burnout Solution. Should be out end of summer, early fall.
Cool.
And it's very applicable to what we're dealing with. Not that her other book wasn't, because it absolutely is, but specifically what we deal with as women business owners. Yeah.
Wow. I love that.
And hopefully it'll just save somebody.
Yeah.
Get them off the ledge.
How was that experience writing a book?
Wild. I mean, I'm so particular about what every single paragraph says. I think even Dr. Gross was like, it's good. Like we're going to be done, but it was great. We spent hours like ideating, recording basically like a podcast together about what our topics wanted to be so that we could go through that, put it in chapter by chapter and come up with solutions for doctors and really around mindset. Once I was able to change my mindset, everything that I was catastrophizing about got better. Yeah. And you level up. You figure out how to manage these things with multiple arms and all of this, but you put in boundaries in place. I cut more clinical days. Like my journey is just very different.
What are some of the tools that you had to put in place or practices that you had to put in place to get to a healthier balance,
Yeah.
boundary.
Well, she teaches some good mind, like at the very beginning, basic part. She taught against catastrophizing scenarios. So the first was recognizing your thoughts. I work on this with my associates all the time. I'm like, you need to check the thought. Is it true? Is it false? Are you making up something in your head?
Yeah.
You think that patient doesn't like you. You think that doctor doesn't like
you,
you. Or do you have facts about that?
Are you familiar with Brene Brown?
Yes.
She always says this line, which I love. It's, what is the story you're telling yourself?
Yes.
And is it a true story?
Yes. Yes. I mean, yes to the 10th degree.
Yes.
It's so important. I have my original notebook from when I read her book, because I would just copy down so much stuff. And one of the things that I highlighted and I've used forever is the idea that your thoughts could be false is wild, because you talk to yourself more than you talk to anybody else. And what story are you feeding yourself? Just like she said. Yes. So that part was really amazing to me. She was like, don't let something bad that happened to you last longer than it took to occur. So if a patient got upset at you for 5 minutes,
it's over.
It's over. Like,
love that.
Move on with your day. Like, you have so many other people you've helped.
Yes.
Like, so little stuff that I could take op to op, because I was just being in between them. I'm sure you're the same way. And it's just like, it's just a lot. And then I decided that I wanted to curate a schedule around my life, not the other way around. What did I want? We had a wonderful nanny. She still works for us now in the businesses and our marketing and stuff. But for the first 10 years that my kids were growing up, I had somebody taking care of them, and I was working, and I was busting my butt. And when that was going to go away, because they were getting in school, and I wanted to do it myself, I was like, what does my day look like now? What do I want my work day to look like? And I tell doctors, you have one life. You don't want to be strapped to your practice. Hire somebody.
Yes.
You want to work 1 or 2 days a week? Great. Do it. What's stopping you? Because I think we get out of school and we just think we just have to die here.
I think a lot of this is just decision making when people make decisions out of fear, or
100%.
that, then your life starts, dictating, life is dictating you, not the other way around.
Absolutely.
But I think a lot of the type A dental medical professionals, we're just got to get it perfect.
Yeah.
No one can do it as good as I can.
Oh, yes.
You got to let go of that. You got to let go of that.
Yeah.
And I think, for me, that's what I had to prioritize. What are things that I absolutely have to do?
Right.
And what are things that other people can do?
Yes.
That's still good enough.
Right.
Absolutely. Because you can't be in 2 million places at once.
You cannot scale. You cannot have the freedom.
Yes. And you can't do them well all by yourself.
You cannot.
Yeah.
No. And you might think you're the only one that can do it right, but that's not true.
Yes.
And one of the hardest things I think for doctors when they're training their teams and stuff is you got to let them fail. You want your assistant to write up a protocol on the laser procedure. You need to let her write it up, and then you're not editing it. She's editing it.
Yes.
You have to empower your team to do some of this stuff for you, because if it's all you're there till 11 o'clock at night, you're going to die. It's not sustainable.
Yes.
And you will not be happy.
Totally
so
agree.
Curate the life that you want to live. And that's why when people tell you and me all the time, I don't know how you do all you do. It's because it's not all me.
Yes.
Literally at the root of it, it's a
Yes.
huge team that we have to make it all happen. And there's a lot riding on it, of course, always, but.
Yes. And
have the
even
schedule that I
in
want.
Personal home life.
Same.
You got to outsource what you can outsource.
Yes.
And,
Yeah.
I don't cook dinner.
Yes. Oh my gosh.
I don't
100%.
the groceries are at the door.
Yeah. I have cleaning people come twice a week. Yes. The same. Instacart.
But I want to drop my kids to school.
Me too.
And
Yeah.
again, it's, we don't do it all.
Yep.
We're one human.
Yes.
But we figure out how to recruit people that can support us.
Right.
And to your point of giving your team autonomy and things to do, you're also giving them an opportunity to put their stamp on the work that we're doing.
Yes.
Because I know I cannot do my work without my team in the office.
Same.
I would not be able to
Yes.
successfully treat these patients.
Right.
And I think giving them ownership of that also gives them drive and fulfillment. And
helps
I mean,
them
they
level
have
up.
they have dedicated their professional lives
Yes.
to our vision and our
Absolutely.
mission.
Absolutely.
It's
a big deal.
I think that's such a great thing, a piece for them to have also.
It is, and I think it's an important part of even training your assistants.
Mm-hmm.
You have to empower them. You need to educate them. You need to be there for them. You don't need to be their best friend. That's a hard lesson learned too.
Yes.
But you have to let them. You have to let them grow in that role, and for them to respect you because you're treating them well, but that they know that you want them to succeed.
Yes.
And as we've have all these practices and the lead docs, and like, are you sitting with your assistant? Are you sitting with your treatment coordinator? They are your team. I know this is my office, but this is your office. Like,
Well,
this is your
and that's
team.
one thing is I have had one associate that would always say, well, I'm not the owner.
Oh,
and
yeah.
I'm not the Dr. Gandhi's owner. And I said, when you are here, you are the owner.
Absolutely.
This is your practice.
Yes.
My practices are small, so we don't work side by side.
Okay.
And I'm like, literally, you are the leader here.
You're my heartbeat here. Like,
Yes.
you got to make it happen.
And I want you to treat this like this is your office.
Absolutely.
Not, oh, I don't own this, so I can't make this decision. No, you make this decision.
Yeah.
You know, you are dedicating your professional practice to this. So it's a mindset. It's
is.
definitely a mindset.
It's 90% of it. And we're not taught any of that getting out of school. And then you own your own business and you need to figure out how to run a business. We're not given those tools.
Yes.
And so that's why I think being a mentor is so important. Like, teaching like we are and being there for each other, all of us working together. Like, hey, what do you use for this? And I need help with this. Like,
Yes.
because dentistry is extremely lonely otherwise. And it's always
and
like a turf war and this, and
especially
it's like, no.
in the airway field.
Yeah. I didn't realize how small it was until
You know, I
started
trained
it.
I trained a colleague in San Antonio, and she messaged me maybe a month ago. It was in March, actually. And she's a pediatric dentist, and she said, do you ever feel lonely being in this field? And I said, girl, I know exactly what you're talking about, because the Houston pediatric dental market is pretty cutthroat to begin with.
Yeah.
And
Okay.
then when you try to do something different,
Yeah.
granted, like, I opened my practice in 2017
Okay.
and was doing all the tongue tie stuff and
Yeah.
got a lot of shade for it.
Oh, I bet you were. I mean, that was the blue ocean
Yes,
time.
got a lot of
but-
shade for it.
Oh, man.
I had an attending during residency tell me, well, I'm not teaching you anything anymore because you're opening a practice right next to mine. Yes.
You're kidding.
And so,
Oh, and you're paying for this residency.
and so,
Oh my gosh.
you know, what I told her is, and this is what I still teach, even though we're so much farther than we
Yes,
were.
the
There's
last 10
so
years
much
have
more
been
collaboration
incredible. Yes.
and understanding. But I tell doctors, like, you cannot do this work or any work that's a little ahead of the curve unless you really believe in it.
100%.
Because you are going to be challenged over and over, and you're going to have to come back to you and your beliefs and your things that make you whole
Yes.
and defend yourself.
Right.
And you don't even have to defend yourself. You just have to know that you're doing the right thing.
In your corner,
Because
gotta
you
believe
are
you're
going to
doing
have
this right.
more people questioning you
Yeah.
than ever before. And if there is any doubt in your mind that you don't think you're doing the right thing for your patient, you are not going to survive in this field.
100%.
You know?
Yeah.
And so part of my, like, growing and getting out of the burnout was really looking at things that make me whole.
Yeah.
Surrounding myself by people that make me
Yes,
whole,
and support
that
you.
support,
Yes.
cutting out anyone that was toxic at all.
Absolutely.
And then figuring out the things that fill my cup that just require me,
Yeah.
not dependent on anyone
Right.
else. For me, I have a very, like, I'm not a religious person, but I have a spiritual practice.
Yeah.
I've been a yogi my whole life.
Oh.
And, you know, I have a daily, like, meditation book.
Yes. Yeah.
Those are the things. And, you know, honestly, the life has gotten simpler and
Yeah.
smaller. And,
Even though we're still so busy, and we
Yes.
have it's so true.
but then I go home and I feel complete.
Yeah.
And I
Beautiful.
I also feel like work is manageable.
Yeah.
And I'm spending the time with the patients because
Right.
in this field, and really it should be in any healthcare field, but especially in the airway field, you're going to encounter families that they are in a dire state.
Absolutely.
And they
are
have been
so desperate.
They
for
have
help.
been bounced around.
Yes.
And so you're not only their clinician, but you are their
Therapist, you're
their
their-
therapist. You got to listen to their stories,
Right.
And then you also have to learn how to create a boundary,
Absolutely.
so that you don't become their therapist.
100%.
So it's a
100%.
really tricky field, and I
Yeah.
feel like women excel in it because we are
Empathetic.
innately empathetic
Yes,
beings.
For sure.
And we feel, especially if you're a mother, you feel for these families. And I went through it with my own daughters.
Right.
And that's when it gets tricky to also be able to take a step back and say, yes, I can help you.
Yes.
But I'm not a magician. This
Right.
is not magic.
Right.
I'm not going to put one appliance in you and things are
Absolutely.
magically going to change.
Right.
It's going to take
not
a
overnight.
team.
Yep.
It's going to take effort on your part. It's going to take changing lifestyle.
Yeah. Oh my gosh, diet, nutrition,
all of it.
Oh.
This is all root cause work. And that, I think, is also a practice that we don't learn in school. And when we're
So
young,
true. Yeah.
that when we talk about mentoring and coaching, really elevating these doctors to have these types of conversations is really one of the biggest keys.
It is.
You know, because you'll start to see the anatomy patterns and the, you know, you'll start to see that. But it's really about looking at all the other stuff that's going on and knowing who to collaborate with.
Absolutely. I mean, I think so much of what you were doing early on there with the knives in your back and all the things I can completely relate to in League City alone. You know, it's like none of the people that traditionally move teeth were very happy with what we were doing. And I knew at the heart of it, the success that we were having, the results were right in front of us with these patients. So I'm like, I'm never going to stop offering this. I would never stop doing it. Show me somebody that we have harmed and then we will stop doing it. Right.
Yes.
But just having that confidence does not come naturally to most dentists. I would say most, not all, but like most. And you do care about what other people think. I care very much less now, but like it's a boundary, you know. You get to choose who hurts you. You get to choose who's in your life that can tell you something that you're going to take into your soul and who you're not, you know. But that takes a little growing up and also having the confidence that I think is very much lacking when they're new at it.
Yes.
Because you're like, oh, I want to go tell this other specialist that I'm doing this or whatever, and I want to talk about it. And it's like, I usually tell them, finish a couple of cases. Just do your thing. Let a year and a half go by.
Yeah.
You're going to have so much more, that you can share so that you're not hit with a question that you can't answer yet or whatever. So it's an important piece of it. And at the end of the day, the kids suffer when they aren't offered this treatment.
Yes.
And that's
not
what I can't let
just the
happen
kid,
anymore.
the whole family.
Oh yeah, for sure.
The whole family.
For sure.
So closing, I would love to hear, I mean, we could talk for hours,
I
but
know.
I would love to hear if you could give a practitioner who's looking to get into this, like one piece of advice. Where do I start? What do I do? And then a parent, you know, a piece of advice from like a parenting aspect.
Yeah.
Who is seeing some of these signs in their kids.
Yeah.
You know, what do they do?
I'll start with the parents. I would say good for you for recognizing it and knock down as many doors as you need to get the help. Don't take no for an answer. Get 5 different opinions if you want to. I encourage my patients to get 2nd, 3rd, 4th opinions all the time. I want you to be so confident with me or whoever you choose that happens and just keep pushing. Don't accept no right out the gate that your kid, you know, shouldn't have expanders or whatever. For the doctors, just know that what we're doing is safe, effective, and life-changing. Know that it's possible, period. Because I think the first thing that you have to undo in your mind is thinking that what we're doing with expanders is not possible. And that's not true. So just know it's not true, or I wouldn't have offices in multiple cities about it, and you wouldn't still be doing it. If what we did wasn't effective, we wouldn't do it. Then start asking around, go to meetings, find somebody to educate you. There are courses all over that you DM Piya, DM me, we will tell you, and find your tribe.
Yes.
So that you don't have to be lonely.
Yeah. And I would say just be curious.
Yes. Challenge the narrative.
Keep being curious. I'm still, we're all forever learning.
Absolutely.
And then one more time, the name of your book.
It's going to be the Dental Burnout Solution.
Okay. Awesome. Thank you so much.
Thank you for having me.
being here.
So
this was awesome. And I just love that, you know, we can collaborate and connect.
Same girl.
And share, you know, tips because it can get lonely.
Yeah.
But, you know, when you find your people, it's so rewarding.
Oh my gosh.
So
it's the best.
thank you so much.
You're welcome. Thank you for having me.
Yes.
Yeah.